wealth inequality in the United States and its effects on nursing. In the United States, the wealth inequality, I feel, is at the core of much of the country's issues. The effects of wealth inequality are very visible throughout all aspects of American life, including healthcare. Whether it be in the political climate or the economy or healthcare as it is currently, the effects that wealth inequality has had are visible everywhere. The effects that it has on nursing specifically affect both professionals and patients alike in many ways, whether that be through the access to healthcare or how patients are able to pay for healthcare services. It all is very pertinent, and it is an issue that us as nurses must address. As it pertains specifically to nursing, wealth inequality um, is very relevant. The most vulnerable patient populations are affected the most by wealth inequality, for example. Understanding wealth inequality can also help us as nurses advocate for change. And our involvement in politics and policy changes as nurses can help bring about many positive changes that can improve the conditions of living for many of our patients, and we share a responsibility to make sure that those conditions are effective and for all of our patients. As without it, we um, risk that our patient populations suffer um, consequences that they have no control over, and we have the power um, of our voices to let their struggles be heard, as we are patient advocates and must always have our patients in mind. As nurses, we must maintain a holistic approach to nursing care. Understanding what patients go through, even if not directly health related, is crucial to providing the highest quality of care. This is where the social determinants of health come in, as the, as these understanding these social determinants of health and how they affect our patients can help us better understand what we can do as nurses to improve their conditions of living or help them navigate and find alternatives to fixing those problems. Wealth inequality affects the most disadvantaged populations and worsens the conditions of living for these populations the most. Because of this, we as nurses um, must be very vocal about what we can do to improve the conditions of living for these populations, because addressing these social determinants of health helps improve the health of the entire population as a whole, which helps push us towards a more equitable healthcare environment. Uh, the National Academy of Medicine speaks about this very well in the latest nursing report, The Future of Nursing 2020 to 2030, which kind of provides us a guideline of what we as nurses need to push towards to improve the future conditions, the future of nursing and the conditions for our patients. At both the population and individual levels, work to improve health and health equity will require cross-sector collaboration and, where necessary, enabling policies, regulations, and community interventions. As the Academy states here, it is crucial for us to realize that in order to help improve the health and conditions of health and the ways that patients can access health all stem from policies, regulations, and making sure that there are community safety nets in place to help these patient populations in need. That will help improve um, the health conditions of everybody as a whole, as a society. Understanding the causes and effects of wealth inequality can help nurses better understand what leads to the poor conditions of living of our disparaged communities and can help us create methods to improve their conditions of living and possibly um, and in turn improve the health of the population as a whole. Beagle highlights that globalization, tax policy, rapid technological progress, education, and weak labor laws are some of the most significant um, causes of economic disparity in his qualitative study. As globalization stands, we have seen that labor markets have dwindled as the exportation of low-skilled jobs has rendered the United States a very deindustrialized country and has led to a lot of low-skilled laborers and workers to struggle to find jobs um, that will pay them a livable wage. Taxation has been a very much a roller coaster in the United States, and as it stands now, we have some of the lowest taxation on the richest people in the world. Rapid technological progress has also led to a lot of the slashing of these low-skilled working, these low-skilled jobs that a lot of people used to depend on. Um, Education is also a problem in the United States as we have colleges that cost fortunes in order to attend, um, in which people can attain these higher skilled jobs and the education that will help them improve um, those fields. Weak labor laws have also been at the forefront as as union busting has become all too common, and the benefits that each laborer and employer provides is every year less and more deregulated. Um, the effects that this inequality has on the society leads to instability across all aspects of life, even um, as we have seen economic disparity, political disparity, just complete instability. And so, when wealth is concentrated among a small segment of the population, access to quality education, healthcare, and job opportunities becomes restricted, making it difficult for lower income individuals to escape poverty, leading to a massive disparity in the health in equity in general, but as well as health equity. Policy is at the center of all significant change, even in healthcare and nursing. Nurse involvement in political advocacy will help the struggles of both patients and nurses alike be heard and push towards change. While I did brush upon some political involvement in, well, while Beagle brushed upon some political involvement in his qualitative study, and its importance towards working towards a more equitable society, it is highlighted in much greater detail in um, Ang and her team's qualitative study, where they take it upon themselves to identify policy solutions that would benefit efforts toward decreasing economic disparity. Effective policy interventions must prioritize investment in education, healthcare, and social welfare programs while also addressing structural barriers to income mobility. This is highlighting that um, what we spoke about previously in Beagle's study, where the effects um, of wealth inequality stand in education, healthcare, and social welfare programs, and investments in these programs will help improve the of the conditions of living for all patients and and our patient population and the people of the United States in general. Nurse advocacy is crucial to ensuring the betterment of our society and the improvement of living conditions for our patient populations. Now, as it pertains to nursing practice, wealth inequality can be combated in a few different ways for the sake of our patients and the population at large. Bringing a greater emphasis to the significance of addressing SDOHs SDOH in healthcare to improve patient outcomes in the long term, forming nursing councils in healthcare facilities to provide a platform for nurses within a healthcare system to advocate for patients and work with the interdisciplinary team toward ways that the system can improve access to healthcare, becoming politically involved as nurses to vocalize the need for policy changes that can improve SDOH at the local, state, and federal level, and finally, volunteering for community health efforts that can provide some aid to the most vulnerable populations in our community is the biggest and easiest change that we as nurses can provide. The biggest challenge to the implementation of these efforts is the willingness of higher ups to work with nurses to make these changes possible. What will determine the impact of our efforts will always be the presentation of these strategies. As communicators, nurses must organize together to bring about the changes that we want to see in our communities, our states, and our country in a way that will motivate others and push leadership to join our efforts. Patients, their families, and the public is at stake, but with the help of nurses of all specialties, social workers, physicians, politicians, and community organizers, we can advocate for change within our communities all together to create a better environment for everybody, regardless of wealth. In return, this effort towards change might motivate others to do the same in their communities, leading to a domino effect that can span across the entire country. Nurses have a responsibility as patient advocates to drive efforts toward change within our society that will help improve the conditions of living for the population and fight the battle against wealth inequality. Our efforts will help improve the health of the population through advocacy for policy changes, the acknowledgement of SDOH in patient care, and easing access to healthcare. With this, we can get at least one step closer toward bringing an end to wealth inequality. While it may not be as significant as we would like, the involvement of nurses in the fight towards bringing an end to wealth inequality is significant enough to warrant our involvement. And thus, that ends my presentation. Thank you for watching.